Okay. This is about Suboxone, um, of the medication Suboxone. Any of you who are not familiar, Suboxone is a medication that is typically prescribed for people that are trying to get off of opiates. So, but it is also being used as a medication for people with chronic pain, which is my case. Not saying that, if it was an addiction issue, I'd be fine with that too. I don't have a problem with that. I'm just stating that's my case. The problem with Suboxone is that I was not made aware of the potential for problems with your teeth. If you can see with my teeth, I have a huge problem with my front tooth here. My tooth did not look like that 2 years ago. This is due to thinning from the Suboxone use. I also have had all of my teeth that had crowns have come off, have broke off. Breaking of other teeth. What it does is for me is thinning of teeth. I was made aware not too long ago that this is not an uncommon problem, to the point that there has been class action suits against the makers of Suboxone, started in the United States and in Canada. So I just wanted to make anyone aware that is thinking of taking Suboxone, has started Suboxone, or on Suboxone and wondering why they're having all kinds of dental issues. This is why. The unfortunate part is that unless you are taking the brand name Suboxone, not the generic version, the name brand Suboxone, you cannot be part of the class action suit. So, unfortunately for me, I have massive, massive dental work to be done, but nobody is going to be helping me with that in any way. Even discussing with my doctor who had prescribed the Suboxone, she wasn't even aware that there was a class action suit. Because when I had mentioned before that I was thinking that what was going on in my mouth in regards to my teeth had something to do with the Suboxone, because I wasn't having these problems prior to starting the Suboxone, she really didn't take it seriously. But when I had my next visit with her and I had learned about this, I said, "Oh, so you didn't think that there was any correlation between that?" Well, interestingly enough, there's a class action suit not only in the United States, but also in Canada for this exact reason. She was really? But You know, at no point in time was there any, oh my God, I'm sorry, you know, that you're like, I had no idea, you know, even though, you know, she wasn't the maker of the Suboxone, you know, no concerns for the fact that, you know, the level of destruction that has happened in my mouth. So I was just wanting to, you know, let people know about this. I will put links in the description of what it is about. In the United States, the law firm is Siskines. No, actually that's in Canada, sorry. Siskines is in Canada, and pursuing legal claims on behalf of Canadians who have suffered oral health issues after taking Suboxone. And on the US side, I will find it, I'll put it in the thing. But I did just an AI overview, and I'll give you a brief synopsis. So it just says, yes, there are ongoing Suboxone class action lawsuits in the United States and Canada, primarily alleging that the drug causes severe dental problems like tooth decay and loss, with manufacturers failing to adequately warn patients and doctors about these risks, leading to costly dental procedures for users. Key allegations: failure to warn manufacturers allegedly knew or should have known about the significant risk of dental damage but didn't warn healthcare providers or patients. Defective product. The sublingual film's acidity is cited as a cause for poor dental outcomes, leading to cavities, infections, and tooth loss. Yes, that is a big thing. So anyone that is not aware of Suboxone, the way that you take Suboxone is, as they state, sublingual, which means you place it under your tongue and you let it dissolve. And then it is absorbed that way. They did it that way, to my knowledge, is because of the origins of what this medication was about, was helping people that had been addicted to opiates and opiate-type medications, doing it this way, it was a way to stop the abuse of the product. Because if you just swallow it, you don't get the effects of the medication. So this is the only way to get it into your system. So on that hand, you know, it might have been extremely helpful for that. But unfortunately, the side effect is it will destroy your teeth, because you can't eat or drink anything for a certain period of time afterwards. I've always waited that period of time and then gone and brushed my teeth, etc., etc. But even with doing all of that, it has still absolutely destroyed my teeth. Like I said, every root canal that I had and there was a crown put on top have all broken off. So all of those all have to be pulled. And then this tooth, because this tooth had a different kind of compound that was put on top. I can't remember what we did with that. That's why it's still remaining like a normal tooth. This tooth was just a tooth with nothing done to it. That's the thinning of it. So anyways, I was making this to make people more aware, and also to let people know about the fact of these class action suits, and that if you were getting your medication through the manufacturer, you might be, able to get in on the class action suit and help get some money to repair your teeth, because every Suboxone person that remains on it for any length of time is going to end up with some level of dental problems. So I will put in the description the information I have, and from there, if you want to do your own research, you can contact these people, and see if you fit into their program. So, thank you.